Hi, my name is Acacia. I'm going to be doing the wound care assessment video. I have my materials here. Since when doing this video, I would make sure to be in proper uniform attire with my name tag and proper PPE. But the first thing I'm going to do when doing this video is I'm going to go ahead and start with the head to toe. And so I'm going to, first thing, I would make sure to bring my materials with me. So I'm going to first start off by, so I make sure I have my stethoscope, I'd have my pen light, and I would make sure to be in proper uniform attire with my name tag, so that way the patient can know who I am. So I'd first start off by knocking on the door and then announcing myself. Hello, my name is Acacia. I'm going to be your student nurse for today. I perform hand hygiene, and I would also make sure while I'm doing that to close the curtain, to provide for privacy. Once I've done that, then I would go ahead and make sure to raise the patient's bedside bed to my good working, comfortable level. Once I've done that, and I want it at least above about my waist or above. Once I've done that, I want to make sure to have the correct patient, so I want to first identify the patient by name, date of birth, and hospital identification number. So I would say hello, so I'm going to be your student nurse for today. I'm just going to identify you real quick. I'm going to look at both arms for the arm bracelet, because you never know what arm it could be on. So I can say that the bracelet is here. Sir, could you please state your name and full name and date of birth for me? So he would state it, and I would make sure to double check with his ID band that it does match him. And I would also ask him, do you have any allergies or anything that maybe might have been missed to put into your chart? And if he said he didn't have any allergies, then I would go ahead and just continue with my assessment. But if he did have any allergies, then I would make sure to update that on the MAR or on his record. Once I've done that, then I'm going to go ahead and ask him if he has any pain. Sir, do you have any pain today? 0 being the least amount of pain, 10 being the most amount of pain. If he were to say he doesn't have any pain, then I would go ahead and continue my assessment. So I'm just going to go ahead and put him in an upright position, since I am going to have to listen to his heart and his lungs. So I'm going to go ahead right away. As soon as I come into the room, I'm going to go ahead and by the way that he answers my questions, whether he's comfortable or not. And as he's answering my questions, I'm going to assess his speech. So I could ask him, sir, do you know where you are today? Do you know who the current president is? Do you know what season we're in? So these are some questions to just orient to person, place, and time. Once I've done that, I'm then going to go ahead and assess the skin. So for the sake, because I am doing an assessment, I'm going to go ahead and wear gloves.
And this is a good time to document all the information you just found for the procedure. Alright, next I'm going to move on to irrigating the wound. I'm going to need to set up my sterile fluid.
Okay, once I've done that, then I'm going to go ahead and start assessing the skin, so I can check the temperature, the skin, is it warm? I can check to see if he has any wounds, any lesions. I can go ahead and also check the pulse.
Now this strafe would usually be
and I would do this for a full
sterile.
minute. I could also go to his legs and assess the peripheral.
Open it up.
So I could check the pedal pulses, and I could go and check the femoral as well, and the brachial and the arteries, to make sure that they're equal rate and rhythm. Once I've done that, then I would go ahead and assess his pupils.
Now I'm going to check for...
So sir, I'm just going to go ahead and assess your pupils. If you could, so I would make sure to use one hand to cover the other.
right up the skirt.
Moving on.
And I would want to make sure that his pupils are equal, react to light and accommodation. So I could ask, sir, could you please follow my pen light? And as long as he's able to follow without any weird eye movement, then that would make sure that his pupils are fine. So once I've done that, then I would go ahead and move on to assessing his heart and his lungs. So I'm going to go ahead and start assessing his heart. And I would want to do it, there's a mnemonic device called A2Man, so I would want to do it order, mnemonic, herbs, tricuspid, and mitral/apex.
Our abdominal pad for after.
So I would listen and I would want to make sure that S1 and S2 are present. There's no lub dubs, no murmurs. And I would also then go ahead and also start assessing his lungs.
Alright, and we don't have to do this later.
Alright, your pulse is strong at 87 beats per minute, and I went ahead and checked your respirations as well, so that you wouldn't change your breathing on me, and it was 18 reps per minute. Okay. Now I'm gonna go ahead and listen to your bowel sound, so I'm gonna
I would want to use the 10-point scale, so I'd start off from up here in his chest, and I would want to end right about for where the diaphragm ends, and I would also do it posteriorly, and I would want to make sure that there's no wheezing, no crepitation. I would also want to note that just the lungs are good and clear. So once I've checked his lung sounds, then I'm going to go ahead and just make sure to check the rest of the body, for any wounds/lesions, any wounds. So I would go ahead and tell the patient, okay, I'm just going to go ahead and lift up your gown. Give him as much privacy as possible. Check the legs to see if there's any edema present. Swelling. So there's no swelling. So now that I've done that, then I would go ahead and put the patient in flat position because I'm going to check their abdomen. So I'd go ahead and put them back to flat position.
now I'm gonna check for strength, okay? Can you squeeze my fingers for me? Okay, very good.
So now that I've done, so I'm going to go ahead and tell the patient, okay, I'm just going to go ahead and lift up your gown, and I would still provide as much privacy as possible. Just by the naked eye, again, I would want to make sure, note any wounds/lesions, see if I see any distension, any non-tenderness, any swelling. So once I've done that, then I'm going to go ahead and auscultate, and I'm going to listen in all 4 quadrants of the bowel for a full minute.
Posterior to the out. Good. Also strong and steady. I think
the skin and you have to know that there's
I want to listen to see if there's any hypoactive or hyperactive bowel sounds. I want to make sure that there's 5 to 35 gurgles per minute. My next step would be to palpate the abdomen, and I always want to auscultate before I palpate to make sure that there's not that I don't cause any further harm. There's a dislodged bowel or anything like that. So now that I've listened to his bowel, there was at least 5 to 35 gurgles per minute. And then I'm going to go ahead and lightly palpate, and I would ask the patient, sir, do you have any pain? Does it hurt as I touch? And if it didn't, then I would go ahead and just note that everything is fine in the abdomen. I could also ask him when was the last time he had a bowel movement. So now that I've done that, then I'm going to go ahead and I would put him back into upright position. And then I'm going to go ahead and assess his strength and mobility and his extremities. I would want to make sure that I wouldn't do anything that's contraindicated for this patient. So if the patient couldn't get out of bed, then I would want to just modify my assessment to his needs. So I could start by asking him if he could take his hands and do flexion extension, if he could do touch his fingers to his thumb. I could also ask him if he could make a fist. I could also ask him if he could push against, to test his resistance. I could ask him to like push against me. I could also ask him to shrug his shoulders, and as I hold his shoulders, that could assess his strength. I could also ask him if he could do hyperextend his arm on each side. And if he could stand up, I could assess his gait, so I could have him walk. Of course, if it wasn't contraindicated. I would also check on his legs if he could do flexion, extension, and do these range of motions without any pain and any difficulty. So once I have done that, I would also note if the patient had any therapies, if they had any, also if they noted any, like if they had a Jackson Pratt drain, or if they had a CPAP, I would want to make sure to assess those to see if they had any awkward discolorations or drainage coming out, because that could cause pain, especially if we didn't assess that. So now that I've done that, that would complete my full abbreviated head-to-toe assessment. And then I would then go ahead and move on with doing the care, which is the wound care. So I would go ahead and take off my gloves and throw those away. Also, before coming into the room, I would have done my full vital signs. So I would have done blood pressure, I would have done respirations, pulse ox. I would also I've checked their pain, so that was their 5th vital sign. And then I would also want to check their heart rate as well, just to make sure that everything is within limits before doing this procedure. So I'm just going to go ahead and perform hand hygiene once again. So I've already identified myself, I've asked for allergies. I would go ahead and reassess their pain. Sir, do you have any pain? Because it could have changed. So I'd make sure to ask if they had any pain. And if they did have any pain, then I would make sure to wait 30 to 45 minutes before doing the wound care assessment doing the wound care assessment, to make sure to provide an analgesic, so that way the patient can not be in pain when I do this procedure. So now that I've done that, I'm just going to go ahead and continue my procedure. So I would want my bed to be above. I would want this bed to be at least above waist level. So just to make sure that way I am not below my waist, which is unsterile. So now that I've done that, then I'm going to go ahead and put my steps to the side. Again, before doing my assessment, I would have also made sure to have disinfected my stethoscope and any materials that I used while performing my assessment. So now that I've done that, I'm going to reposition my patient, since I did know that he has an abdomen wound. So I'm going to go ahead and put him flat, like put him back down. And I'm just gonna position him my way this way. So I'm gonna lightly move him, and I'm gonna put these pillows here. Now I would want to make sure and ask him if he is comfortable. I don't want them to be in any awkward position, but I would want him to be at a sideline position, so that way when I do irrigate the wound, it drains into the bin that I'm going to do it into. So I perform hand hygiene. I reposition my patient. Then again, I would also explain to the patient what it is that I'm going to be doing to them. So I would say, sir, your doctor wants me to do a wound irrigation, and this is just to make sure that that wound is healing properly and that it's getting clean. And I would make sure to explain every step as I go. Once I've done that, then I would go ahead and start. I would obviously want to be in proper PPE. I would look at the contact precautions on the patient's chart. So if it said droplet, I would make sure to have a mask with me. But since I am doing wound irrigation, I would want to make sure to be in proper PPE attire. So gown, mask, goggles, gloves. And then just go ahead and put this on real quick. And ideally, I would want to put this on outside the patient's room before I come in.
Alright, Mrs. Wilson, we're all complete. Can you tell me your pain level on a scale of 0 to 10 again? Alright, well, if that changes at all, remember, just let us know. And remember, my name is Shannon, I'm your student nurse, and I'll be taking care of you. The call line's right here in case anything comes up, and you need us, alright?
So it is on. So now that I've done that, then I'm going to go ahead and put on my mask. Okay. I'm going to just go ahead. I would make sure to remove my watch because it could cause problems with my sterile gloves that I'm going to use. And I would just go ahead and perform hand hygiene one more time. And I would allow this to dry. Also, before placing any materials on this bedside table, I would have made sure to use the disinfectant, and I would have waited a couple minutes before placing anything on here to make sure it's good and clean. I want to make sure that I have everything in my side of you. I also want to make sure that I have a trash can, so that way that if I need to throw away anything, it'll be thrown away. So I'm going to go ahead and first start off by putting my blue pad right here under the patient, so that way it'll protect their bed and their gown from any fluid drainage. So, and I only want to expose the area that I need to work with. So I make sure he was covered the rest of the way. So I'm in proper PPE. So then I'm going to go ahead and start my skill. So now that I've done that, I'm just going to go ahead and start taking out everything that I need. Some of this stuff would be in packaging, but because of short supplies, we're just going to have to say that it would be. These are my gloves. These are I'm going to put on when I'm getting ready to start to do my sterile procedure, and I can ask the patient if it would be okay to put my gloves on his bedside table or on his bed. So I'm just going to put the rest of these materials right here, and if I need them. So first things first, and I can do this with clean hands as long as I perform hand hygiene before. I'm going to go ahead and start off with my sterile drape, and I would want to make sure that I have plenty of space. So again, it would be packaged, but we're just going to assume it would be. And I would want to make sure to not touch anything within the 1-inch border. Everything inside is what is sterile. So anything that were to touch inside here would make this unsterile. So now that I've done that, then I'm going to go ahead and grab my sterile solution. Actually, I can go ahead and grab my tape, and I'm just going to start off by just getting some tape. 4 pieces of tape is what I need. Wait, okay.
Don't you have to say like aortic pulmonary? Yeah. And I feel like
Sorry, this tape's kind of hard. I grabbed the cloth tape versus the other tape. I should have grabbed the paper tape. Okay, so now that I've done that, I have my tape set to the side. And so now that I'm going to go ahead and do is I'm going to go ahead and open my sterile container. And usually this would have gauze already in it. So So I'd want to make sure to open it. So again, nothing touched inside except the sterile container, which was sterile because it wasn't the package. So I'd go ahead and throw that away. Then I'm going to go ahead and grab this is my ABD pad, so I would grab my gauze because this is what I'm going to need.
Make sure you pull up something so I do the pattern right. It was so hard to do it.
Yeah.
Nothing there.
I just realized I made an error. Before even setting up my sterile field, I would have want to assess the wound first. So I'm just gonna, it's still my line of view, so I'm gonna make sure that nothing touches it or contaminates it. So I'm just gonna go ahead and assess the wound real quick. So I've assessed my patient for pain. I made sure that they weren't in any pain. So I'm just gonna apply gloves real quick.
And then I'll do hinge and it's like regular rate. I just do it around my lungs and heart. Yeah.
Oh.
I usually, when I did it, I did the rate, I said I'm gonna do it for a minute, but then I do it for 30 seconds, and then I kind of look at this like chest, and then I say, alright, your pulse is this. I also went ahead and did a respiration, so you just keep your breathing pattern on me.
Okay, so now that I have my gloves on, I'm gonna then go ahead and assess the wound. I have my ruler right here. I also have my depth and diameter. So I can check this. I'm gonna first go ahead and start off by removing the ABD pad in the direction of the hair growth so that it doesn't cause any pain with the resistance. So I'm going to go ahead and just remove it from top to bottom because I don't want the patient to see the wound because it could cause them stress by doing so. So I'm not just going to go ahead and I would throw it away. Well, actually, before throwing it away, I could check to see if there was any drainage. So if it's serous drainage, sanguineous drainage, and I would go ahead and throw that away.
And speech is clear.
I would want to make sure to assess the wound. I could assess the color, odor, consistency, if it radiates any heat from the top, and then I can go ahead and measure it.
At this point, I'm gonna check the skin.
So that is about 5 inches.
I'm gonna
I could also
check the recoil.
take this and measure the distance.
Skin is pink, warm, dry, and
That's about 5 centimeters in distance, so then I would make sure to record that. I could also take my cotton applicator right here, and everything is here sterile, so it's not touching. If it were to touch the patient, it'd be okay as long as nothing else touches it. So I could go ahead and just assess, and depending on where the skin or any drainage ended, I could then assess the length or the depth of it. So I could just assess the length real quick. So that's about 3 millimeters in depth. Then I would go ahead and throw that away, and I would make my necessary documentations. So now that I've assessed the wound, then I would go ahead and take off my gloves.
Everything sounds good. And for the sake of this video, I did it.
Now I would throw that away. So now that I've done that, I'm just going to perform hand hygiene one more time. And then I can go ahead and ask my patient, sir, are you doing okay? Are you in any discomfort? Because I do want to assess the patient as I'm
like this.
doing this procedure throughout. So now that I've done that, I'm going to continue on with my sterile field, and I kept my sterile field constantly in time, so there's no contamination. So I'm going to continue putting on my materials. Ideally, my syringe would be in a package, so if it was in a package, I'd open it away from me, and I would plop it right here. but so we're just going to say that it is sterile and it was in a package. I want to put my ABG pad there as well. So I'm going to open it up. Okay. So notice again it fell within the border, so it's still sterile. Then I'm going to go ahead and check my, I'm going to take my ointment. The touching the outside of the ointment is unsterile, so I would want to make sure to only touch that with my dirty hand when I put on my sterile gloves. I'm going to take my solution, I'm going to check to make sure that it hasn't been tampered with, it is not expired. So I would go ahead to open it. I'm just going to remove this.
I see that you have a wound here, so I'm just gonna listen around that.
I'm going to take my cotton applicators. And then I'm just going to go ahead and put these here. So I would go ahead and make sure to open it. I would have used another container that it is sterile, since I'm going to have to put the solution in there. And I would have not made sure to not touch anything in the inside to keep its sterility. Because of the fact whenever I put my, try to get my syringe solution from out of here, it's too narrow. So I'd want to open it, holding it with my palm in my hand. And although it is sterile, I could do a little bit of pour off so that way it still contains some of the sterility. And so I would have made sure to not touch my backside, so I could have just moved my trash can here, just done it here, because the second I turn my back to my sterile field, it is unsterile, so I'd want to just keep it open, and I'd want to make sure to put the cap face up. And once I've done that, then I'm going to go ahead and start off putting my sterile gloves on. I have all my materials that I need. One last step that I need to do is get my cotton applicators, because I don't want to touch these with my sterile gloves because it would be unsterile. So I'm just going to go ahead and put them on my sterile field here, right there. I can throw this away, put this in my okay.
Alright, your pulse is strong.
And I would actually want to pour this solution into my sterile container right here. So I'm just going to go by the order, so if it said to do 30 cc's, I'm just going to go ahead and put all of it, since we're going to use all of it. And I want to do it at least a couple of inches, and I want to make sure that I don't pour at too much of a rate, because it could cause splash. It could splash and contaminate my sterile field. So now that I've done that, I have all my materials set out. I'm going to go ahead and start off by putting my sterile gloves. So I'd then go ahead and perform a hand hygiene one more time. I'd let it dry.
And it is strong.
Just going to move this a little bit
I'm going to check your other pulse down here.
so that I have enough room. And I'm going to start off by putting my sterile gloves.
And that is it.
And then I could ask him, sir, I'm just going to go ahead and, if it's all right with you, put my sterile gloves on your bed.
Yeah. Yeah, I know you got it.
And I'm going to use my non-dominant hand to put my first sterile gloves on.
Well, I'm gonna check skin, and then I'm gonna use the
Okay, so now that I've done that, I'm going to go ahead and reach into my other glove.
now to check for recoil, and I should.
And then I said, skin is pink or warm and dry.
We need to put them in.
Okay, so now that I've done that, then I can go ahead and fix my other gloves here.
What this intercostal is to the right
Okay,
of the.
so now I am sterile, so I want to correctly note what my sterile hand and then my dirty hand. So first things first that I'm going to start off with is I'm going to go ahead and I'm ready to assess my wound. I'm going to go ahead and use my
I can't say that. I was like mid at the fifth.
I'm gonna go ahead and get my I'm gonna go ahead and get my sterile container, and I'm gonna go ahead and so this is my sterile container, and I'm gonna use this to irrigate the solution and create a barrier. This is gonna be my sterile hand, so it's still sterile. I'm gonna go ahead and grab
Remember what you forgot last
about 30 cc's.
And then while I was checking the pulse, I was like going through my head, okay, is there everything? Yeah, I kind of started to like look at the camera.
So I want to make sure that I did grab 30 cc's.
Oh, I said,
So now that I have my 30 cc's, then I'm gonna go ahead and
but I would have pulled the gown up.
I would have wanted uncapped first, because it did have a cap and I didn't realize it. And then I would
I think
go ahead and make sure to grab
I
some
lung
more.
sounds, and I said, okay, I'm gonna listen to the lung sounds, and I did aortic. But I think maybe I said heart. I don't know.
Or I don't remember.
Got 30 cc's, so I did grab 30 cc's. So now that I've done that, then I'm gonna go ahead and start irrigating. So now that I've put this towards the patient, it is unsterile. And I'm using my dominant hand to pour the solution. For the sake of the mannequins, because they do have things connected to them, I'm not going to put the solution in there. But I would want to make sure top to bottom, do it top to bottom, inner to outer, and just keep doing it until it ran clear. So now that I've done that, then I would go ahead and assess the drainage in here. And I would go ahead and make sure to put that in a biohazard bag, because it does have blood in there and drainage as well. But I'm just going to go ahead and dispose of it. And so this hand is still sterile. So I'd go ahead and dispose of my syringe, but I'm just going to go ahead and put it here to the side. My glove did touch the side of this mirror here, or this curtain here, so I would have been unsterile, so I would have made sure to get brand new sterile gloves on. So now that I've irrigated the wound, then I'm going to go ahead and dry around the sides. So I'm going to go ahead and take my sterile hand, put it in my dirty hand. Well, actually, no. I would have taken, put this and just cleaned around it. I wouldn't have. No, yes, I would have put it in here, because I am gonna continue to get my gauze for my sterile field, and I want to make sure to do around, top to bottom, and that I just clean around it, because we don't want to cause any skin breakdown. So then I'm gonna go ahead and continue to grab my gauze, drop, dry around it. So now that I've done that, I can go ahead and dispose. So my area is now clean. I'm now going to apply the ointment, and so I'm going to use my sterile hand right here to grab my cotton applicator, and I'm going to use my dirty hand and grab some, and I want to make sure that it hasn't been tampered with. And then I can just grab the amount that I need. Okay. So now I'm just gonna go ahead and put this to the side, and I would want to make sure to apply a generous amount, top to bottom, until it's covered, and then I could go ahead and dispose of that. And then I could go ahead and use my other sterile, because I didn't touch any part of the wound. I'm still sterile, so I'm gonna go ahead and grab this, grab my dirty hand. Go ahead and grab some more.
On the skin as well, but I would like for you to see the pattern.
Okay, and I'm gonna keep grabbing a generous amount until it has the amount that it needs, and I'm gonna keep putting it on. And then I would go ahead and dispose of this. I'll put this back to the side. So now that I've done that, then I'm gonna go ahead and grab my ABD pad, and I'm gonna still use my sterile hand. And I'm going to put this over the wound. So I could use this hand to hold it. And I would make sure to tape it. Okay.
Hi.
You didn't do
I'm a student.
Okay. And I would want to use one last piece of tape so I can now touch around my sterile field because I'm not, look, the wound is now covered. So of course my gloves are now unsterile. Ideally I would have done this before putting on my gloves. But I would have grabbed one last piece of tape and I would have put the name, date, the time that I changed the dressing over across the wound so that way anyone else who comes in can know when I change the dressing. So now that I've done that, I'm going to go ahead and then remove my gloves. Dispose of that. I would make any necessary documentation of the odor, color, consistency of the wound. I would make sure to ask the patient if they're okay. I would reassess their pain level. I would then go ahead and put on new gloves, and I would make sure to dispose of all my equipment according to policy. I would put any blood or drainage into biohazard bag. So I'm just going to go ahead and put on these gloves. I guess she'll find out when she watches it. Okay. And I'm going to go ahead and dispose of everything. For the sake of the video, we do have to save some of the stuff because other people will need to use it. So I'm just going to go ahead and save this. So I would make sure to dispose of everything, though, according to policy, if this were a real clinical situation. I'd make sure to then go ahead and take this patient's blue pad and put it to the side. I would have thrown it away, and then I would also go ahead and make sure to put the patient back in position. I would have changed gloves because I did touch that pad, and I would have thrown it away. Trash can fell. So I would perform hand hygiene once again since I am going to touch the patient, and I'm going to put them back in proper position. So I'd have them lay back down, and I put them back in a comfortable position. I cover them back up, put their gown down. If their gown was dirty, I would make sure to clean it, change, have a new one put in place. I'd make sure to put them back in. At least at a semi-polished position unless contraindicated. So now that I've done that, I would then make sure to take off my gown. I would want to make sure that I would leave the room before doing it. But the way that I would take off my PPE is I would first take off my gown. And I would dispose of that. I would then perform hand hygiene because I did touch the gown. And then I would take off my gloves. But again, I would have done this outside the patient's room. So now that I've done that, I would make sure that the patient is in a comfortable position. I would reassess their pain. Sir, do you have any pain? Do you feel like that procedure went well? I would ask them if they needed anything. I want to make sure to put the bed back in lowest position. And I also want to make sure to leave the call light in place so that way the patient can contact us if they need anything. So, okay, that's a pretty good position. So now that I've done that, then I would go ahead and perform hand hygiene. I would finish any documentation that I needed to do, and then I would go ahead and leave the room, take my exit.